Good afternoon, everyone. Thanks so much for joining us. So I think we'll kick off. Thank you and welcome to today's Meet the Pathologist Virtual Careers talk. My name is Tacha and I'm the Communications Officer at the Royal College of Pathologists. Today I'm joined by three pathologists, Dr Hamed Sharaf, Dr Sarah Ruane and Dr Farah Shahi. We'll be hearing from them very shortly. Just to say that there is a Q&A function at the bottom of this webinar screen. So if you'd like to ask any of our pathologists any questions at all about their career or what it's like being a pathologist, please do pop your questions into the Q&A section and we'll get to those at the end of the three talks. So before we get to the talks themselves, I just want to show you this really quick 1-minute animation entitled "What is a Pathologist?" It just gives a little bit of a background about what pathologists are and what pathology is. So I'll just play that for you now.
Pathologists are experts in disease. Their job is to work out what is making someone unwell, advise on their treatment, and stop other people getting ill the same way. Pathologists work in laboratories, in clinics, and on hospital wards. Every blood test, allergy diagnosis, or search for infection will involve a pathology team. People who work in pathology services specialise in particular areas. For example, if you're anemic, a haematologist will find out why. When you find a lump, a histopathologist will work out if you have cancer or not. If you have diabetes, a chemical pathologist will plan your treatment. And when you've got an infection, a microbiologist will advise whether or not you need antibiotics, and if so, which one. Bridging science and medicine, pathologists underpin every aspect of patient care, diagnosing, treating and preventing disease. They are a key part of the healthcare team. Pathology.
So we do have a couple more virtual careers talks lined up for the next couple of weeks. So there's one next Wednesday on the 17th and another one on the Friday next week. So if you'd like to hear about some of the other specialties, then please do sign up for these careers talks. And also there's a lot of information on our web pages and also on our social media channels. So we're on Twitter, Facebook, and on Instagram. Instagram in particular, our content is directed towards students, undergraduates and trainees. So please do follow us on there. And we've also got a YouTube channel where you can find loads of videos about the various specialties within pathology. So there are 17 specialties. And things like videos about journeys of samples, so what happens to your samples once you send them off and they go into the lab. So please do check those out. So we're going to kick off today with a talk by Dr Hamed Sharaf. So Hamed, I will pass over to you. Just to mention again, the Q&A section is open, so please do submit your questions there and we'll get to those after all three talks.
Well, hi everyone, I'm Hamed Sharaf. Thank you very much, Tasha. So I'm an infection doctor. If you see my title, I'm in my year 7 of training. And I'm training as a joint doctor in microbiology and infectious disease. And today I'm just trying to give you a quick overview of my life as an infection doctor. And I think for most of you, you might not really relate to what an infection doctor is, because it's a new term. And when I say infection doctor to some of my friends who are non-medical professionals, the first thing that comes to their mind is usually this. So actually, yeah, this is me on a ward dealing with a certain unwell patient. This is actually not a true patient. We were doing a test run to see how well prepared we were. And what you can see me wearing is what we call personal protective equipment. So these are equipment which are necessary to us to protect us from some certain infections which we might be exposed to during our work. And we basically have to be quite slick in getting them on and taking them off without exposing ourselves to a potentially harmful bacteria or virus. And this situation tends to happen when we deal with certain suspected infections. For example, the pandemic at its start, we were quite cautious when dealing with patients suspected of having COVID-19 infection. So we were wearing this on and off quite frequently. And also some of my friends would think that, oh, you're actually spending your day in the lab, which is partly what we do. So I do spend my time in the lab, not necessarily viewing slides or culturing bacteria or looking at various tests. I do receive test results which are quite significant, quite important for my colleagues dealing with the patient face to face when I'm on that role. And basically my job is to actually pass this information on and see if I can help my colleagues treating a certain infection or understanding this result in a way which would help them in treating the patients that they are seeing. So yes, I do spend my time in the lab partially, but at the same time, it's not what everyone would imagine, such as in these pictures. Also, sometimes they would be just sarcastically thinking of us as compared to this serious house. I'm not sure if you've heard about it before. It's fairly old, but was quite popular at some stage, quite successful as well. And it's fairly interesting. I think look it up and maybe watch a couple of episodes. But I have to say it's not realistic. It does, yeah, discuss some true infections, but this is not what we do on a daily basis. It's dramatized. What I like to think that I do is, so I think of myself as the link or the person who puts the pieces of the puzzle together. So I see patients, or my colleagues see patients with various infections, whether it's a virus, whether it's a bacteria, whether it's a fungus. And basically we try and find out, one, what is causing this infection, and two, how best to treat it. And with the knowledge that we get throughout our training and practicing this specialty, we get more and more experience of adequately treating these infections, and obviously in the end, treating our patients for better outcomes. And I think my specialty, what I enjoy about it when it comes to that, is that we see quite a soon result of our treatment. So we see our patients getting better, leaving hospital well, back to their families and friends, which is what we want to do. And it takes me to my next slide, which is the aim of what I'm doing is basically we want to see everyone getting better, because this is what we all want, because we want our patients to go back to their friends and families well and safe, and also making sure that they get best outcomes when we're dealing with an infection. So this is kind of what drives me forward, really, is ensuring that my patients are safe and sound. And this also correlates to what I tend to do outside of work, and I'm a keen gamer. This is kind of a very well-known old place, not very old, PlayStation hit called The Last of Us. And I enjoy playing this game because it reminds me of what I do. And actually there's skills that I use in gaming, which is more or less correlating with what I do in real life. So when gaming, I have to have, like, especially in this game when it's a role-playing game, have to have much attention to details, look for clues, and try and solve different puzzles, which I have to say is not far from what we do here in my specialty as an infection specialist. And also you have to do that all in a safe way to kind of pass through each and every challenge in order to get to the final outcome, which is really completing the game. But in real life, it's actually curing my patient and seeing them leaving hospital. So as much as I enjoy gaming, I also enjoy my work, and it kind of fits in together, I think. And a little bit of a personal insight to why I wanted actually to become an infection specialist. So in this picture, there's a man who is my grandfather. My grandfather passed away when I was 5 years old, and he passed away as a result of a complication of actually an infection. I'm not sure if you heard about hepatitis, which is inflammation of the liver, and some causes of this condition are actually viral infections. So he was infected with hepatitis C, one of these viruses, and he passed away because at that stage there was no treatment. But actually, in this day and age, we've got a very good treatment, which is very safe, and in 12 weeks of treatment, our patients are well and cured of this viral infection. So I think when I was at that age, I kind of started thinking, well, this is infection. Doctors are supposed to be curing infections. Why has my grandfather did not have a favorable outcome? And that kind of, in my mind, triggered my interest in infections and understanding what infection entails. And I kind of, it took me off on this journey, which I'm still on and will always be learning about. And usually with any talk I do is I try and pass a message, which to me is the most important message of the day. And it's about washing hands. So on the left-hand side, what you can see is a Petri dish. And a Petri dish is what we use to culture bacteria. And basically this jelly-looking thing is a nutritive substance which has all the possible nutrients that a bacteria would or a fungus would require. And you can see an imprint of a hand. This is actually someone just putting their hands on the plate, which is an unwashed hand. And what you can see is like all sorts of bacteria and surrounding that surround and fungi that surrounds in the environment growing on this culture because this person had not washed their hand. So I think washing hands saves lives, and if anything, this pandemic has proven that washing hands is one of the few interventions that we can do to protect ourselves from being infected with this virus. So wash your hands regularly. That's my message of the day. Thank you very much for listening to me, and I think we will be taking some questions towards the end. But yeah, again, thank you very much for having me today.
Thanks so much, Hamed. That was great. So yeah, like Hamed mentioned, if you have any questions, please do pop them in the Q&A. We'll move on to Sarah's presentation next.
Thanks, Sacha. It's appearing quite big in my screen. Is it properly adjusted on yours? Okay, help.
Let me try that again.
Thank you.
Can you see that now?
Yeah, it's not just focused on one slide. It's sort of got the overall PowerPoint screen.
Is that better? So this is now on slideshow.
Yeah, that's lovely. Brilliant. Hello, everyone. I'm Sarah Ruane, and I'm a histopathology trainee, which means my job is looking at cells and tissues. And I currently work at Wythenshawe Hospital, and that's within the Manchester University Foundation Trust. So thank you all for logging on, and thank you even more to my colleagues for all the technical help. So I'm just going to tell you a little bit today about my path into pathology, and why it worked for me, and hopefully encourage you to also join the pathology pathway as well. So excuse me, I'm going to do a bit of Chris Whitty and say next slide please as we go along. So next slide please, Thatcher. So my interest in pathology started when I actually started secondary school. And at that time, University of Nottingham did a weekend residential where you could go and learn a bit more about pathology. And for me, I was particularly interested in forensic pathology. So I went along, had a brilliant time at this residential. And then the last presentation was by a forensic pathologist. So I was obviously very excited about that. But unfortunately, he ended up on a bit of a downer. So he said, look to your left, the person next to you won't finish their medical degree at all. And then look to the right, so this person won't finish their houseman job, as what junior doctors used to be called back then, and they won't gain successful entry into pathology. But if you look at the person right at the back, they might become a pathologist, and even then they might not become a forensic pathologist. So I did feel a little bit disheartened after that and think, well, maybe pathology is not for me. And next slide, please. So this combined with the fact that I was told I probably didn't have the aptitude to do a science subject or medicine. And my least favourite word is aptitude, I must admit. And that combined with also me then doing A-levels without chemistry, and made me think, oh, perhaps medicine isn't for me. I can't do medicine. But I was still keen to go to university. So I went to university and did psychology. Next slide, please. But there was just this niggling voice in the back of my head saying, this isn't what I want to be doing. I think I really do want to do medicine, even though I might not be cut out for it. I really want to give it a go. My university had an access course to get into medicine. So I got help from a really nice chemistry PhD student to brush up on my chemistry. And I just went for it. And I applied, I got in. I really enjoyed my medical degree. It was a brilliant laugh and also hard work, I must admit. And then I went on to complete my foundation training in Manchester. And then I decided to go into anaesthetics, which is the doctors that look after your airways, look after you on intensive care and in maternity units. Next slide, please. So the picture on the left was me most days in anaesthetics at the start of my career, but the picture on the right became pretty much me a bit more regularly, because there was always this niggling voice saying, I'm loving anaesthetics, but there's something missing here. There's something not quite right that I can't put my finger on. I don't have much of a work-life balance at the moment. I'm not getting to bounce off colleagues and discuss ideas and treatment plans and patients. I'm not getting to use the most up-to-date technologies that I quite like to. And also, I don't think I'm using all of my skills that I could be. So that niggling voice just came back again. Next slide, please. So I thought, well, I had a look at all the specialties, and then pathology really caught my eye, because it would give me a little bit more of a work-life balance, because there's less on-call shifts and less weekend work, so I get more time with my wonderful dog, who's in the picture there. I'd still get to be practical, so I'd still get to do procedures, I'd still get to be present doing things with my hands and working with my hands, which was important for me, because I didn't want to be at my desk all the time. And I get to meet some wonderful people I get to work with every day. I get to do what we call multidisciplinary team meetings, a bit of a mouthful, where I get to work with other colleagues and bounce ideas about patient care on them. I get to find out what was going on with the patient. So I get to say, the patient has got this, the patient has got that, and this is how we can make them better. And I would also get to use some really cool technology like microscopes that get to see literally right down almost to the atoms of things, and be at the forefront really of technology. And I also could use my weird skills. And I think as you grow older, it's easier to recognize that perhaps your weird skills can be used in slightly different ways that you didn't think so. So a couple of my weird skills was I'm very good at recognition. So before I joined pathology, that was facial recognition. I'm also very good at picking things out. So I wanted to see whether any of you guys might have these strange skills. So next slide, please. this is a brain teaser, and I love doing them. And I managed to beat the record quite a few times. Again, a bit of a weird skill, not previously very useful. So can you find the unlock lock in all of these locks? And the record's 10 seconds. I'm going to give you 10 seconds. Okay, that's up. Can I have the next slide, please? So it was there for any of you that might have got it. These are in several newspapers, by the way, if you want to improve your times. So I'm very good at spotting the odd one out, and that's very useful in pathology, because sometimes you'll have literally a whole field of cells and you might just be able to pick out that one cell that's not quite right. Unfortunately, I've become quite adept at doing that, and I think it's from doing all these brain teasers. Next slide, please. I'm also very strangely very good at facial recognition, and I can remember the look of something very easily and remember it for later on. So I might be showing my age a bit here, but this is a character from the Muppets Christmas Carol, but you might know them in a more popular sitcom, or certainly popular when I was working as a houseman. So see if you can recognize who this face is and what they've been in. Next slide, please. And it's actually Simon's mum from The Inbetweeners. So it's a bit of a strange skill, but it means that when I see a strange cell that is quite often a signal for a very specific disease or infection, I can drag that cell back up into my memory and go, yeah, I know exactly where I've seen that before and I know what it means. And that can be very useful in pathology. Next slide, please. So basically what I want you to take away from this course, from this presentation, sorry, is that everyone has the ability to do medicine and pathology. And if you're in a room with anyone else, I want you to look to the left and say that they can do medicine and they can do pathology. And I want you to look to the right and say, yes, you can be a pathologist as well. Because if I can do it, everyone can do it. And it's a brilliant specialty for having all your skills under one roof. Thank you very much, and look forward to hearing your questions a little bit later on.
Thank you, Sarah. That was really great message as well. Yeah, please keep your questions coming in. Got a couple already to get us started after the next talk. So we'll now go over to Farah.
You are a galaxy, because literally on every surface of you, inside and out, are trillions of tiny bacteria, viruses, and fungi that we collectively call microbes. And there are more microorganisms in your or on your body than there are stars in the Milky Way. They're invisible to the naked eye, except via our lovely tools. But these microorganisms can actually work in harmony with your body. So for example, we now know that there's a community of these microorganisms in your gut called the gut microbiome. And this can act as a training ground for your immune system, but it can even affect the way that you think. But sometimes the microorganisms can get into the wrong place. And when they do that even, we get symptoms of infection. So things like fevers and shivers and shakes and hot and red areas. And then that's where I come in. So my name's Farah Shahi. I'm an infectious diseases and microbiology medical doctor and researcher. You may have heard of us a lot from such things as this pandemic, where we were early COVID fighters. And in fact, COVID is a really good example of an infection caused by something that doesn't live in or on you already, but instead is external to you. So it passes from person to person. And there are other infections that also are external to you. So something like malaria, which is a parasite that's carried by the mosquito, for example. And these differences in all the ways these different microorganisms act and spread is a really good example of why there's so much variety in my job and in infection medicine in general. But I didn't always know that I wanted to be a doctor. And when I did know I wanted to be a doctor, I didn't know what I wanted to do. And that's fine, because things don't always go to plan and you don't always stick with the first thing you do. I as well, like Sarah, also did anaesthetics for a while before I changed my mind. But I started to think about what I enjoyed and what I was good at. And I slowly realised that one of my favourite things was mystery solving and finding out the rare answer at the end of a story. So when I was younger, and I have no idea what this means, but I really wanted to be a dinosaur hunter or a private detective. And I really liked all of the murder mystery programmes, and I liked the X-Files. And as you may know, Sherlock Holmes was actually written by a medical doctor, and it was based on one of his medical teachers. But aside from the mystery side of things, I knew as well that I didn't necessarily want to work in an office all the time. I knew that I wanted to do something practical, something that was hands-on, and I knew that I wanted to travel. And actually, when I was sat where most of you guys are, my favourite subjects before A-level were things like drama, English lit, and languages. And I think it's a really irritating myth that doctors and scientists don't enjoy arts. And actually, it's a sign of creativity, and that's what I hadn't realised, that all of these things tapped into my creative skills and that desire to be creative. And actually, I get to do all of these things in my job as an ID and microbiology medic and a researcher. So I'm not limited to an office. I'm in one right now, but I don't always stay here. I get to meet people both in my clinical work and within my laboratory work. And my research work. I get to be in the lab both in my medical job and also in my research job, and I'm actually working on things that have a purpose, not just sort of ticking a box. It's something that helps people. I also teach life-saving skills like CPR. I've been involved in the recent Oxford vaccine trials, as well as other vaccine trials actually. And because I'm really interested in global health, just through my job alone, I've managed to travel the world. I've researched the gut microbiome that I mentioned at the beginning of this talk, and now I'm working on new technologies basically to discover what's wrong with a patient, so how to diagnose them, which all of that combines that love of mystery solving and thinking creatively. My love of X-Files is thoroughly met by the fact that I get to read about, learn and treat patients with things like parasites, and yes, all of these things live in or on other people. And in my spare time, I get to use my superpowers for good on Instagram because I get to teach infection medicine on there. And that also taps into my creative skills too. And sometimes I get to act like I'm not scared and use my drama skills as well. I am joking. Obviously, we work in really supportive teams. It's never really that scary because you're well trained and you do everything you can, obviously, in the best interest of the patient. But have a little think, like, what is it that you really enjoy in your favorite subjects? Because I think sometimes I used to think that you choose your favorite subject and then that has to be your career, or it has to set you up for certain careers. And while some of that is true, it's actually about the skills within your favorite subjects that you probably don't even realize you're picking out, that can actually really help you in choosing your career in the future. And actually, you may have more skills and more abilities than you even realize until you really think about it. And if you're still working it out, you can tonight now look up at the night sky and know that you are a galaxy in your own right and anything is possible. Thanks for listening.
Thank you, Farah. So that brings us to the end of the talks. And we're now going to take questions from the Q&A section. So please do keep adding to this. So I'm going to kick off with our first question, which is from Harry H in year 11 in Dewsbury. Have you ever been infected with a disease from your work? That's to Hamed and Farah. Who wants to go first?
Yeah, definitely.
Go on, Hamed.
Well, I mean, I remember in last May it was, and it was the start of the pandemic. Well, a few months into the pandemic, and I had COVID. And definitely that was picked up at work. I think at that time, we didn't have much understanding yet. And even among ourselves, we were not wearing masks in hospital. So I'm sure it was actually picked up via one of my colleagues who had it, and he was not symptomatic. So, well, he or she. But yeah, I did. I had COVID.
Yeah, I haven't. I think I should have had COVID, but I'm not entirely sure how it didn't happen because my partner, they got COVID. So But yes, I have had colleagues who've unfortunately caught COVID during the pandemic for similar reasons. Generally speaking, we try and take obviously precautions against it. So there's the PPE that Hamed mentioned, but there's also things like in the lab nowadays, we have certain parts of the laboratory that are called category 3 laboratory areas. So they're where the microorganisms that are particularly worrying, we work them up in there, so it keeps people safe. And there used to be a practice, because this is going to sound a bit, well, it is a bit weird, but certain bacteria, for example, give off certain smells, and you can decide what bacteria is what by smelling it. And now nobody is allowed to smell things because it's dangerous, and that's how you get Brucella. So yeah, there are precautions in place, but unfortunately sometimes it does happen, but obviously you do your best not to.
Thank you, Ruth. It's good to know that there are precautions in place so that you don't catch things. What was the process of getting into pathology, for example, university courses and grades? So, Sarah, shall I start with you? Do you want to mention what sort of subjects you did at A-level? And you mentioned a bit in your talk already.
Yeah, so I did biology, history and English at A-level, which obviously to get into medicine, they prefer it if you have biology and chemistry, or if you have sort of two sciences. So I did what's called an access course, which was a 1-year course done by my university at the time, which was Lancaster, where you covered first year university biology, chemistry and biomedical sciences. And if you completed that, it basically gave you a pass for not having chemistry at A-level. And quite a few people do that nowadays. Obviously, it's easier if you can try and get it right from the start. Makes your life a little bit less complicated. But there's also what we call postgraduate medicine, which is still a medicine course, but normally a little bit shorter and takes into account sort of the experience you've had from other subjects beforehand.
Thank you, Sarah. Farah, what subjects did you do at A-level?
Yeah, so I did biology. I think you only needed half, like an AS level in biology at the point that I was doing it. I don't think you need it at all now. That might have changed. I think some universities do, some don't. So I did biology, chemistry, I did maths. I'm not entirely sure why, but I did. I quite enjoyed it actually, because I really didn't like chemistry. And I did a really geeky subject, but I did an AS course in Latin. And for the chemistry, I did really badly, and I basically had to retake the whole of it in 1 year, and I had to get a tutor, and I had to work really hard. And thankfully, in the end, it did work out for me. But you know, some of my sisters have both done graduate entry. They decided to do something else first, and then done what Sarah's just described in terms of graduate entry courses. So it's a lot better now in terms of access of getting in.
Thank you, Farah and Hamed.
I'm a bit different because I qualified in Egypt where I was before coming to the UK. So I did A-levels, but that was like a completely different system. So I came here as a graduate already, and then kind of done my initial training in medicine here before joining like a pathology specialty. The only thing I would maybe add is that there's also the route of being a clinical scientist, which does not require entry to medical school. It's basically studying biomedical science, and then you can then progress from there. So that's another route to think about if you don't think medicine is for you. And again, it's another entry point to pathology in general as a scientist rather than like a medical doctor.
Thank you, that's really helpful. What does your normal day consist of? So Sarah, I'll start with you again.
So always starts with a cup of tea as soon as I get in, no matter what I've got on the agenda. Normally starts with what we call a multidisciplinary team meeting, which is where one group to do with a care get together. So that's both pathologists, the surgeons that are involved in that patient's care, radiologists, which are people who take the images that are required to help treat a patient, a specialist nurse who looks after the patient and is sort of like their go-to and their one-to-one, and then lots of other specialties as well. So we go there, we chat about the patients, about what's going on with them, how we can best treat them. And then after that, it might be doing what we call a cut-up session in our laboratory, where we receive lots of biopsies, which are like small fragments from people who've got something wrong with them. We take a little bit of it to see if we can find out what's going on, or they could be whole organs, so we might get sent a piece of bowel, and we have to make sure that we prepare that and cut it up in a way that we can find out what's wrong with that piece of bowel. And then the rest of the day might be spent looking at things under a microscope. So after we've prepared our specimens and our little pieces of tissue and cells, we look at them on a glass slide under the microscope and see if we can actually diagnose what's wrong with the patient. And normally fitting a bit of cake in somewhere as well, but that can be in between any of those.
Thank you, Sarah. Farah and Hamed, does your normal day look similar to Sarah's? Is that quite different?
You go first, Farah.
I kind of have 3 normal days. So if I'm doing ID work, so infectious diseases, and I'm on the ward, then we'll probably do a meeting in the morning to discuss all the patients. Then we do a ward round where we work out the plan for the patients for the day. And then the more junior members of the team will probably do the jobs while I might go and see other patients, so patient referrals, or go to a clinic where I see the outpatients who are coming in to visit. If I'm on microbiology, then it usually involves either learning stuff in the lab or looking through results, and mostly it's about taking phone calls from other people within the hospital. And if I'm on a research day, which I've been on for a while now, then in my research days, my days are kind of my own and they vary quite a lot. So at the moment I'm learning to do computer coding, and I'm trying to write my thesis, and I'm also doing different studies, and sometimes I'm helping with vaccine trials, and sometimes I'm in meetings, so it varies a lot.
I'm similar to Farah actually, because I do also microbiology and infectious disease, so it depends. I got my clinical days where I'm just on the ward or seeing patients in clinic, but also got the days where I'm at the lab doing microbiology. Yeah, mainly taking phone calls, but you get the occasional trip to the lab just to speak to the biomedical scientist about a result, or even like looking down the microscope on something just out of interest. Also, one part of what we do is to sign off reports that go to the doctors and to the GPs for different sample. So that's one thing we do as well. Yeah, so it's a bit of a mixture depending on what I do on the day.
Thank you. Well, it sounds very varied, which is one of the lovely things about pathology from all the pathologists that I've spoken to. They all say the same thing. It's quite varied and interesting. This is an interesting question. Do forensic pathologists tend to work on crime scenes often? Who wants to go? I'm sorry.
So do you want to do that? So I'm a general pathologist. I'm not a forensic pathologist. So in pathology, you do a couple of years general pathology to get like a good foundation in pathology, and then you subspecialize. But forensic pathologists have got a really varied sort of work. So they can often be, yes, found at crime scenes, helping the both like sort of police with what's happening, and sorry, excuse me, that's my neighbour in the background. But they can also spend quite a lot of time in court discussing their findings. I think unfortunately there's a bit of hanging around with that, but and then they can also obviously be in the mortuary as well, which is dealing with, unfortunately, cases that need to be found why and how they've died.
Thank you, Sarah. So I'm going to move on to another question. This is from a year 8, who's asking, how do you identify which disease a patient has? Farah, let's go.
Yeah, so it'll be different, I think, for me and Hamed than it will for Sarah, for example. So I'll let them chip in as well. But so from our point of view, if I'm seeing a patient, it'll be trying to piece together the patient's story. So we call it the history, but I think this is where the sort of creative skills come in, because what you're actually trying to do is synthesize that patient's medical story, like what is it that brought them into hospital, what symptoms do they have, what signs can I find if I look at the patient, and then in my head what I'm doing is sifting through and working out what fits with what picture. So if somebody has like crackle sounds on their chest when I listen with my stethoscope, then I might be thinking of a pneumonia. But if somebody has like a really red patch of skin, then I'll be thinking of cellulitis. And then from that, or a skin infection. So then from that, we can kind of work out which bug is most likely the cause of that patient's illness. And from there, we can then work out how to treat it. And from the microbiology side, we'll try and grow that bug in the lab as well. And that will help us work out the diagnosis.
Sarah, is that quite similar for you for histo as well?
So with histopathology, it's although when we get sent either a biopsy or a specimen, like I was saying, we tend to get a little bit of clinical information, so we don't get a terrible amount about the history and about the background. And basically our sort of role in diagnosis and finding out what's wrong with the patient is mostly by having a look at what the cells and the tissue look like on the slide. And different patterns generally indicate different forms of disease or cancer. But we also have something called stains, which is where the glass slides that we've got, we can attach different colours to them according to what the tissue and the cells are made up of. And they attach themselves to certain cells. So, for example, if you've got a cancer of the breast, sometimes you can tell whether that cancer is just in one place or whether it's actually becoming cancer and spreading out by seeing whether it's gone past some cells that shouldn't be allowed to go past. They should be like a fence that stop cancer from going out, and you can see that on the slide. And we've also in pathology got the future of pathology is called molecular pathology. So we find some genetic markers, which are basically to do with your DNA. And if you've got faults in your DNA, we can apply those to the slides and see if those faults light up. And then we can say, okay, this is what's wrong with this person. And it's because they've inherited this gene or they've got this gene. So that's probably the way pathology is going. And that's quite new and quite exciting.
Thank you, Sarah. I've just had a look at the time, so we've got time for one more question. This is to all of you. So it's a two-parter. What is the best part of your job? What do you enjoy the most? And what is the most challenging? So we've had a couple of people asking similar questions about this. So Hamed, do you want to go first?
Yeah, sure. So I think it's partly what you've mentioned, Tasha. So the variability about what we do, because it always keeps you busy and always keeps you, not bored, basically. So it's really interesting. So I enjoy that, and I enjoy the part which I mentioned in my talk about actually the seeing our patients getting better and kind of going back to their families. So that's another part I enjoy. What I hate, I think it's the feeling of being helpless sometimes, like at the beginning of the pandemic, when we didn't know what to do because we're dealing with a new infection which we've never dealt with before, we have no experience with. So this is times where I feel helpless when there's nothing much that I can offer, which is fortunately not very frequent in our specialty. But yeah, I think at these times where I feel, I hate what I do.
Farah, what do you like the most and what's the most challenging part of it?
Yeah, so I think what I like the most is quite similar to Hamed's. Actually, it's the thing that attracted me to infection medicine was the fact that I realized that I really liked intensive care medicine and the people and acute medicine and emergency medicine. And what I really enjoyed the most within that was seeing the really sick people get better, and the really sick, like dramatically sick people you often see have got a really bad infection. And it's one of those few things where you can like pinpoint what to do and then they just magically improve and you get to see them become a human being again and go home and get better. I also really like the variety in it. The challenging thing for me is it's similar to what Hamed said, but in a slightly different format, in the sense that we have a lot of patients who are very vulnerable patients. We have a lot of people who are, for example, drug users or who are marginalized in some way by society or who have an infection that carries a lot of stigma. And sometimes it can be very difficult to get them the right support. And I find that very frustrating that, you know, we have a lot of people that we could, I think, help better socially out in the community. And there's a limit to what I can do from a hospital setting as well. So.
Thank you, Sarah.
So I think similar to what you've already heard. So I think the variety is really important. I like that, you know, every day I go into my job, there could be something completely different or something completely unique waiting for me. And the satisfaction of being able to give that patient finally a label for what they've been experiencing and what's been going on and try and help them, I think that's really, really satisfying. I think the hardest thing is, because we're so busy at the moment, and I think this affects pretty much everyone, is that you want to be able to do that in a really timely manner. You want to be able to give patients diagnoses and treatment plans as quickly as you can, because you know how much it means to them. But just the sheer pressure on the NHS means that things take a lot longer than you'd like. So I think I find that the hardest thing at the moment.
Okay, thank you, everyone. Unfortunately, we've run out of time, and I know there's still lots of questions in the Q&A. So thank you for all the questions. I'm sorry we couldn't get around to all of them. We will be sending around all of the information about our careers pages, and there's a lot more information on there about the different pathways into pathology and courses and subjects that you need to do to get into those various pathways. So please do look out for that email. All that's left for me to say is so thank you to Sarah, Farah and Hamed, and to all of you for joining today. I hope you found that useful, and I hope that you'll consider a potential career in pathology. And have a lovely weekend, everyone. Take care.
Thank you all.
Bye.